Hi, I'm Scott Steffen. I am the Service Chief for Facial Plastics and Reconstructive Surgery at Vanderbilt.
My name is Shai Yang. I am an assistant professor. I've been at Vanderbilt for 2 years, and what brought me here was honestly the opportunity to work with amazing mentors such as Dr. Reese and Dr. Steffen.
In our ever-growing division, we have Priyesh Patel as a third faculty member, and we have a fellow in facial plastics who really serves as a clinical instructor. So we have a real division now with 4 clinicians.
Vanderbilt's a great institution, and there's a lot of opportunities. We have 5 residents a year, and they're getting a great breadth as well as hands-on training to the different aspects of facial plastics.
One thing that's nice for the residents is the broad experience that they get, not just all the surgical techniques, but the locations they get it. So they will have facial plastic experience at the university, adult enterprise, that's also at the Children's Hospital. They also get facial plastics at the VA, and now increasingly so is experience doing Mohs reconstruction at our dermatology office, which is off campus, which is a whole nother skill set.
The different things that we do in the office, we do some procedures such as Mohs reconstruction, blepharoplasty, brow ptosis repair, upper eyelid implantation, scar revision, and then we also do Botox, injectables such as fillers, laser, microneedling, PRP, and scar revision.
Our residents get a lot of hands-on experience in facial plastics. And so when they're with us during a rhinoplasty case or a Mohs case, the expectation is that they're doing that case. And it's always commensurate with their experience and how the case is going. Our residents are expected to do many, many parts, if not all of that case, depending on where they're at in their training. And I think that's probably why we've had more people go into facial plastics at Vanderbilt in the history of our department than any other subspecialty.
The residents have a lot of unique opportunities that I think we offer at Vanderbilt. Our focus on facial reanimation as well as microtia and atresia repair, which is not a lot of people do in the country. Additionally, the residents are getting exposure to in-office procedures as well as cosmetics in an academic setting, which is also something that's a little more rare. They also have the opportunity, if they're interested, to go with private practice partner who is a clinical professor at Vanderbilt and see just what is private practice cosmetic facial plastics like.
We get the residents involved early, so they get facial plastics not just at the very end. It's as a PGY2 and then really dive in as a 4 and the 5. That's an aspect that is very helpful when we see all the people that go into facial plastics for fellowship training.
Another aspect, especially for the residents as well as for our division and our field, is the research program that we have. We meet every month. It's usually, the meeting is led by our fellow, where all residents who are not only interested in facial plastics, but are just interested in getting involved in research join this meeting.
Some of the interesting research opportunities is through the EMG-guided use of Botox and synkinesis treatment. Things whether or not we're just looking at clinical papers, studying different muscles that we're treating and the efficacy on patient symptoms, but also going in a deeper dive in neurophysiology or muscular physiology.
Not only is it great for our department, but it's great for the residents so they can network, get used to presenting and being comfortable with the ideas and research they put forth.
We do have a robust maxillofacial trauma experience. Nash Vegas is ever growing, and all the different maladies and traumas that go on in the city, they come here. We're the only level 1 in the region. And as a result of that, then we get a great opportunity to learn all the different surgical techniques that are mirrored in trauma that you would get for facial rejuvenation. The approach to the faces are oftentimes the same, and so that dovetails their experience.
I would also add mission trip opportunities. Within our own division, both Dr. Steffen and myself attend medical mission trips at least once a year. And then also we have just a number of other faculty members, including in the head and neck division, who go on regular mission trips. So there's a lot of opportunity to participate in global mission work.
What makes this place great is the people. Just knowing every day you get to come and see terrific colleagues. I love the fact that we have a growing division. We have, there's a lot of excitement for the future, for the present, about the new procedures that are new techniques, new ideas that Dr. Patel and Dr. Yang are bringing. I know that was always the plan. I want to learn from them. I want to learn from our residents, and that's one of the reasons to be, in my opinion, in academics, and especially at Vanderbilt, since we take for granted, I think, about how nice a place, the fact that our interactions with plastic surgery or oral surgery, oculoplastics, dermatology, it is seamless. And sometimes you forget that that's not the case in other locations. But it makes such a difference as to how effective you are in your learning, how effective you are caring for your patients, and just the joy of coming to work.
There are a lot of things that I'm excited about for the Division of Facial Plastics. I think that we are going to be, not only have we been expanding our cosmetic procedures in the office, but also expanding our cosmetic surgery that all of us provide. And then we've already developed strong programs in microtia and facial nerve. I think we're going to continue to establish and become a center of excellence where patients travel to seek our care in facial reanimation and microtia.
I've seen over the years the power of Vanderbilt Otolaryngology residency diploma, and whether that's being folks that are getting a private practice job, and they've done extraordinarily well with that, but probably another way of seeing it is the fellowships that our graduates achieve year after year after year. And certainly getting messages from people over the years that are in different subspecialties, you realize how well the Vanderbilt education has served them.